with an exceptional speakers with me here in the studio of the Simulation Center at this wonderful conference. It's my pleasure to introduce Dr. James Cleveland from the United States, from Texas. And Dr. James, I would like you to introduce yourself more. Tell me where you're from, what's your background, what's your experience with simulation so far. First of all, welcome to Saudi Arabia. It's our pleasure to have you with us in this conference.
Well, thank you. It was a real pleasure to be at this conference. A little bit my background, I was in the military for almost 30 years. I was an enlisted combat medic, and then I went to college, got my Bachelor's of Science in Nursing, and then actually soon after, I joined all of you in Saudi Arabia in 1990, and I was here till 1991, and I was in Dhahran for the war. In the area, the largest mass casualty occurred when a Scud missile hit near the coast. So our military hospital, along with the Saudi military hospitals, helped us recover our, it was all U.S. soldiers, but the Saudi military medical and our U.S. Army, our hospital recovered over 125 patients, and we lost 25 casualties. But it was amazing to work with the Saudis at that point. So that'll bring that back to full fruition 30 years later. So anyway, I continued on with that and stayed in trauma systems and emergency care, and I got my master's degree as an advanced practice nurse in acute and emergency clinical nursing. So I work hand in glove with the emergency physician profiles, and we've always done interprofessional education because of our footprint. We exist together. So as I move through the systems, my doctoral work is actually on interprofessional education, and that's where it brings us back to DOE. So when I leave the military in Fort Sam Houston, which is known as the military city in San Antonio, Texas, I literally moved from my office at the trauma center to my new office at the university. I've been there now for 10 years. I've been retired from the military 10 years, but I'm still actively involved with the Military Institute. I work with the military, not as much as I'd like. I'm mostly in the academic setting, but I run the Simulation Center for the entire university. It's the Center for Simulation Innovation, and it's mostly nursing at this point, but our physician counterparts and the respiratory therapists and all the other therapy groups and the physician's assistants are all coming over now to do interprofessional education. So that's why it's called the Center for Simulation Innovation, not the nursing, because all are to be at our table, and we shouldn't be training in silos, because how can we expect to practice interprofessionally if we don't educate our students in an interprofessional environment?
So far from what you've seen in our conference and in the exhibition and the different centers booths, what do you think simulation in Saudi are going to be heading toward in the next couple of years from what you've seen? You can tell from what you've seen, physicians is kind of dominating the area of simulation in Saudi, specifically anesthesia, emergency medicine with some OB and peds, and nursing do exist, but still not to a bigger or larger scale. Is this similar in US, or is kind of different, or do you think we're projecting differently than you guys?
Actually, I wish we had that problem where we had more physician buy-in in simulation. So that's actually a good problem to have here in Saudi, because it's just the opposite. For the most part, the medical models will do simulation, but only at the task level. But at the team level and everything else, it's been difficult. But that tide is changing for us finally, and there are more people coming to the table with the interprofessional education consortiums. So it's getting better. I would say in some ways, Saudi is ahead as far as, because, you know, use an American football analogy, it's great to have a good football line, but if without a quarterback, so the highest license in the room is going to be the physician, so we definitely need that quarterback on the field, and you guys have that. And the rest of it will follow for you. Now for us, I still integrating it into professional practice is our challenge. That's where I'm at right now. I have a lot of champions, physician champions that are working with us, but that is actually our issue, not your issue. I think that from what I've seen, especially like today, the wild, wild west is getting settled down, and people are sharing information. I know I have read articles that have been produced here in Saudi Arabia. I think the common ground is the Society for Simulation in Healthcare. I think that gives us all a forum internationally and nationally, even at local venues, to kind of figure out what to best do. It's a clearinghouse for simulation. And SSH I'm grateful to, because it used to be medical simulation, and they've opened they've broadened the tent, so to say, that everyone's welcome now in the Society for Simulation. So I think I'm just going to say I'm impressed with what Saudi Arabia has to offer. I mean, where as far as even the government side, the military side, you guys are willing to try things. Hubris seems to be an afterthought. No one really cares about it. Everyone's trying things, and everyone's leaving their comfort level here. Back in the States, everyone should change except them, and they want to stay in their comfort levels. But I think we're coming along. But I think in many ways you need to celebrate your successes in simulation.
That's wonderful to hear. I want to kind of move wheels to accreditation, and especially accreditation from societies like SSH or the Royal College. What's your experience with accreditations? Did you guys go through accreditation for your center? And if so, what were the challenges and things that you learned going through such a process?
So that's a really good question, because I'm actually seeking accreditation right now. I took over the simulation center about 3 years ago. When I got in there, we weren't collecting data. They were doing simulations, but there was no rhyme or reason. It was based on the talent of individual faculty and the staff. I have a great staff, but the staff was kind of under the thumb of the faculty. When I got in, I was able to find an emergency room physician who is actually simulation trained, who has jumped in to work with us. So with the residents, the emergency room residents are working with our undergrad nurses. So that's a really good opportunity. But academic curriculum simulation, it's coming along, but there's so much to be doing as far as the evidence, like the accreditation process. I still have probably another 6-7 months of data to collect. Now, some of this stuff, just by luck, as an academic, I was already collecting data, but they require so many years of good data pull, which it's evidence-based, so that's exactly what I'm looking for. So it's going to take a while for my bus to get where I want it to go, but the accreditation process, I think, is really going to help get all of us on an even playing table, and we will be able to cross-talk and share. And I think if we share, simulation's really not about me or you, it's about ultimately better patient care. And if our patients benefit from it, we're all winning, right? So anyway, I really believe in the accreditation process.
That's wonderful. Any last words for us you want to tell us about this conference, about your experience so far, and what are you looking forward in the next day and a half in this conference?
I'm just, I knew you guys were doing innovative things. We have 2 of Saudi students in our doctoral program at the university, so that's why I was in communication with the Ministry of Health anyway. And I knew they were doing great things. Our deans come, but I had no idea the level of simulation you guys were doing, and I'm just taking it all in. I'm very proud of all of you, and I'm glad to be and honored to be here, because I needed to see this to believe it. So you guys should be very, very happy for your prospects.
Thank you very much. Appreciate your time, and I hope you have a wonderful time in the conference and in Saudi Arabia. Pleasure. Thank you. عفواً.